Well, aloha Hawaii. Thanks so much for tuning in. I'm Ryan Kalei-Suji, joined by Yanji Denise. And of course, this is Spotlight Hawaii. It is Monday, December 28th, the last week here in what has been certainly a crazy year in 2020 as we look forward to 2021. And to wrap up the show this week and starting off, we have a special guest who's joined us multiple times on this broadcast.
That's right. We are welcoming Governor David Ige once again, and we have so much to talk about. The president over the weekend signing that CARES Act 2. What does it mean for Hawaii? What kind of aid are we in line for? And also, we want to take a look back at the year that was and look ahead to 2021. So joining us from his office at the Capitol is Governor David Ige. Governor, good morning. Thank you so much for being here. A relief now that the president has signed this bill. What does it mean for Hawaii? I know that there are still a lot of details being worked out.
Yeah, we have been going through the bill, and it really is great news for Hawaii. They are providing direct aid for a lot of things that we knew were priority services and things that we're doing that will be able to continue to receive federal funding. You know, for example, they do have more than $150 million to the Department of Health to help with testing, contact tracing, isolation, all of those things that have become a core part of our pandemic response. And there's a significant support for the public schools. More than $170 million to the public schools, which will help us tremendously.
Let's talk a little bit about the education factor and all that, because we know that there was talks of furloughs and, the teachers obviously pushing back on that. How does this sort of impact the negotiations moving forward and furloughs for state employees?
Yes, certainly, Ryan. We did evaluate the bill, and we know that it does allow us to delay the furloughs from the January 1st start date. So we're working through the details and trying to understand what restrictions. We are glad to see that a lot of the restrictions that were in the original CARES Act have been relaxed or eliminated altogether. So the funds that we will receive will certainly be a lot more flexible in a couple of key areas that helps us with the furloughs.
Does it look now that you won't have furloughs, that when you talk about delaying furloughs, does that mean furloughs for everyone or just for teachers? Are you still thinking that certain sectors will have to take some days off, or how are you figuring that out?
Yeah, so we are looking, Yanji, for all of the executive branch. So we are delaying furloughs for all executive branch employees at this time. And we'll probably, after we review the bill, have a better idea about how much resources we're getting, and then we'll announce a specific date that the furloughs are delayed to.
Through this CARES Act funding in the first round, we saw a number of programs that were started up by the administration, by the city and county of Honolulu, all of which had a deadline of the end of this year to spend all that money down. What happens to those established programs? Can they continue forward, such as the rent relief program and other things that you folks have sort of started up? What happens with all those programs that were initiated?
Ryan, as you know, it does take a lot to spend money, especially in a lot of instances. These programs are brand new. We never had anything like that before. So the bulk of the funds will be spent by the end of December, like we had planned. The rental relief funds will be spent. Whatever is not spent to support rent and mortgage relief will be placed into the unemployment trust fund so that we can pay down that loan. But we will be spending every penny. And even though we do have some flexibility to extend the funds, the overwhelming majority of it would be spent by the end of this year.
What programs do you think you will be able to continue on, though? I mean, looking at what piggybacking on what Ryan just said, is rental relief going to continue and some of the other things that you've stood up? I know the fear was that you'd stand up these programs and then have to stand them down. So now that there is this continuity, does rental relief, for instance, look like it will continue?
Yes, Yanji. The new CARES support bill does actually have specific funds to the state of Hawaii for rental relief. It actually broadens the program. As you know, we were focused primarily on helping with rent, but the new CARES Act does provide or does allow for support of other utility costs as well. So, we probably will be extending the program for sure. There will be some rental and mortgage relief that we'll probably have to shut down the existing program because it's based on what the state wanted to do. We'll be evaluating what the new law provides and what kinds of costs it does allow for. And then we will be probably working with the same partners. They've worked really hard to stand up this program to be able to identify those who have been impacted and really help us reduce the fraud. So, we're excited about being able to help many, many more people. And we definitely are up to the task.
One of the departments, obviously, that had some issues during this pandemic was the Department of Labor and Industrial Relations, specifically the Unemployment Office. A lot of help was brought in through CARES Act funding for just, a variety of reasons, just to be able to help with the backlog. What happens in terms of personnel? Will that department continue to be able to get support through positions and additional help with call centers and adjudicators and other means that which the CARES Act funding helped to support?
Yeah, one of the things that we're really checking on, Ryan, is that there was a lot more flexibility provided to the department to allow us to contract for services and adjudicators. The base federal law does not allow us to do that. We can't have contractors providing support for adjudication or call center activities. So that's one of the things we're really drilling down and trying to make sure whether we can or cannot. And Eustachio has already initiated a process to hire people because we weren't certain how the federal government would deal with subcontracts and that kind of activity. So we are staffing up. And then we'll be reviewing the law to see if it gives us flexibility to contract out for services.
Let's shift gears here for a second to talk a little bit about safe travels. We're getting some questions about that this morning. Are you anticipating any changes to the program? How do you think that it's going right now? The Lieutenant Governor was on here last week, and he had said that 2 weeks ago rather, and he had said that one of the things that he would push for in the new year was allowing people who had been vaccinated and could verify that they'd been vaccinated be able to bypass any kind of quarantine or testing restriction. Is that something that you foresee for January or beyond?
Yes, as the vaccines roll out, we are trying to incorporate the notion. Our understanding is that the federal program would for those who get vaccinated, be able to give them sort of an ID card that says, who they are and the fact that they were vaccinated. They haven't released what the details of that, but we know if someone has been vaccinated that they're not COVID positive and they wouldn't be spreading the virus. So we definitely will be incorporating those who are vaccinated can travel without restriction.
And beyond that, we know that there has also been additional proposals that have been put forward, but sort of put on hold because of the holiday season, such as, additional testing, a second testing here on Oahu. Derek Kawakami, the mayor of Kauai, has requested for the opportunity to do a second testing that the county would pay for 3 days after arrival. Where do you stand on sort of this flexibility with more of the counties giving them options and based on the proposals that they have submitted so far?
We continue to work with the mayors in the other counties to try and establish a second test program. Over the weekend, I did get communications from Mayor Roth, and on Sunday alone, there were just under 2,000 trans-Pacific arrivals, and they actually had, right now Hawaii Island is testing right upon arrival. They're administering an antigen, a quick response test upon arrival. And they had 13 positives from that just under 2,000 travelers coming. So I do see value in the second test. And the challenge is really how to incorporate a second test without taking away testing capacity from our local residents. We want anyone who is symptomatic or needs to be tested to be able to have tests available, and we don't want to give away those tests to travelers. But if we can identify a testing source or others who can provide the test without taking away from residents, I think that that would be something that we would be able to work.
Chun James is joining the conversation this morning. She says COVID-19 has exposed Hawaii's huge vulnerabilities in putting its economy in one tourism basket. Now DHHL wants a casino. What's your reaction to this talk of having a casino in Kapolei?
I have been, I've studied the issue for many years, and I really do think that it doesn't really provide economic value to our community. It would change the nature of our hospitality industry, and I believe that the benefits would not exceed the social cost of gambling here in the islands. And so, I definitely will be working with the Commission and the Hawaiian Homelands Program. I think we are all committed to developing more homesteads and placing more of the beneficiaries in housing, but I don't believe that casino gambling is the best way to do that.
Staying on the topic of diversifying the economy, there has been obviously a lot of talk during these times of COVID of moving away from tourism. What realistically do you think is something that we could look at in the immediacy? We know that you have already submitted your budget. You have your state of the state coming up next month. I mean, is that something that we can expect to hear more details or any ideas that you have on ways that we can diversify the Hawaii economy? And what do you think is the most realistic in a shorter time frame?
Ryan, what I see is really acceleration of the digital economy. Just imagine, would we have been sitting here a year ago doing a virtual meeting with both of you? We never would have decided to do that. It has forced all of us to embrace technology in ways that we never imagined. Hawaii and the world is getting to be smaller, and clearly we want to continue to bring visitors to our islands to experience it. But if you think about it in the other context, virtually every company and every organization has embraced telework, has hired people wherever they are with the skills that they need. And we need to help local businesses and local organizations capitalize on the new digital economy. And with the notion that, I can virtually get a job anywhere on the planet if I have the skills that somebody wants. And I think that that's really key.
I want to go back to the vaccine for a second. We heard, there was a lot of enthusiasm with the initial vaccine, and then there were some hiccups, especially on the mainland, some states not getting their deliveries as planned. How is Hawaii's rollout going? Are we still on schedule? And on a personal note, when do you expect to be vaccinated?
Yanji, there were some glitches and delays. Part of that is really understanding what the production process would be and when would the vaccines be in hand. But, we've had tens of thousands of doses delivered. And we do expect that every week we'll be able to get more and more doses of vaccines here in our islands. So I think you'll begin to see an acceleration of the availability of vaccines, and then we can get to the other priority areas, and then ultimately the general public. I really felt that I wasn't going to jump the line or cut in line, as we talk about here in the islands. I think that we should have sufficient vaccine available so that all priority 1A people, which is healthcare workers on the front lines, as well as residents and staff in long-term care facilities, should be able to get vaccinated as we move into the first week in January. So I'll be looking at, and I'm ready to take the vaccine as soon as it's my turn. And with the numbers that we're getting virtually every week, that should be soon.
Okay, another question. I want to kind of backtrack on what you had talked about earlier, and you shared with Mayor Roth sharing that there had been 13 cases of people who tested positive with their antigen tests on the Big Island. But that also leads to a larger question of, we know that when you sort of change the ruling on the 72-hour testing that is required for anyone coming in from out of the state, that they had to have that test result in hand. Since you've implemented that and changed that, what have you seen in terms of the number of positive cases that have resulted still when they arrive to Hawaii. Have we seen a reduction in those cases? Of course, we know that you said that there were 13 on the Big Island, but what else are you hearing about some of the positive cases that are still coming through from this Safe Travels program?
Yeah, certainly, Ryan. We have seen a significant reduction in the number of positive cases that are coming in, but we still see positive cases. It's dropped by more than 50%. Typically, we were seeing 13 to 15 positive cases coming through, even though they had a negative pre-travel test, or if they just traveled without a test and then got their result as they landed or in transit. We are seeing about 5 positive cases per week now. So there's been a tremendous reduction, which has helped us so that we're not dealing with so many positives after the fact.
On the subject of case count, Tammy Aguiar has a question. Are prisons counted in our numbers? I believe they are, but not toward Oahu's tier system. I know you folks made that change recently, but looking at the prisons, we've seen some pretty large outbreaks. What's being done to control those spikes within the prison systems, given how crowded those facilities can be?
Yeah, I mean, Yunji, that's been the biggest challenge, is that our prisons and jails are overcrowded, and we do have really group living situations in all of our facilities, which really spreads the virus. We have tested all of those in prison and the staff, and will continue to test on a regular basis. The challenge at Halawa, for example, is there's no way to separate and segregate those who are infected from others. And we do our best to isolate those infected with COVID. But it's just the nature of the prison that makes it a huge challenge for us. We do typically will see that within a week or two, we can get the total case counts under control. And then it's just really trying to make sure that they don't spread the virus within the facility. Both Halawa and OCCC has taken us a while to get through and isolate just because of the overcrowding conditions.
I want to bring in another question, and this question is about vaccines. Can out-of-state visitors staying with Hawaii relatives in Hawaii get the vaccine in Hawaii? Maybe this goes to a broader question of, is the vaccine only for Hawaii residents? I mean, how are you going to determine who gets the vaccine, and how will that be categorized? Can people who are visiting here for a long period of time, or are commuters or travelers, how will you allow, or will you allow out-of-state residents to get the vaccine here in Hawaii?
Ryan, I do think that what we have established is a priority system. And as we get to the lower priorities, and really then it would be the general public, then those who are traveling here would be able to get the vaccine. But we do want to focus on our residents first, and we do have priorities established. And, our frontline workers, for example, we want to vaccinate those in our public schools as quickly as we can. They are, as part of Priority 1B, we want to be able to offer the vaccine to other essential business employees, because they need to be at work in order to provide our infrastructure. And then the general public, and I would consider the visitors to be part of the general public, would come after all those priority needs are provided.
Let's talk a little bit about the changes that are coming. Of course, Honolulu Hale and on Hawaii Island, you've got 2 new administrations joining leadership in the state. Do you agree with Mayor Kirk Caldwell's tier system? Do you think that Mayor Blangiardi should continue that, or is there another way?
I do generally support the tiered system, and Libby Char and the Department of Health was very involved with the mayor's team in developing the tier system. So just having the general public be aware and focusing on some of the metrics so they can know when we are crossing the boundaries, and when more stricter requirements would be put in place just allows all of us to do our part to reduce the spread of COVID-19. I haven't had a chance to talk specifically with Mayor Blangiardi or Mayor Roth about the tiered system. I told them that generally, it's based on the premise that the more active the virus is in our community, the more restrictive we have to be. And I think generally they both agree to that framework. Now, whether we publish specific metrics and move automatically, I know in my discussions with Mayor Blangiardi, he would be more inclined to be flexible because we are all committed, I think, to getting people back to work. And if there are ways that we can mitigate and focus the restrictions so that we don't have to shut down, a wide range of businesses, I think we all want to be able to do that.
Speaking of just shutting down businesses and the tier system and the impact that it has, obviously one of the biggest industries has been the tourism industry. What are you hearing from tourism officials in terms of the volume of people that are coming in? Are they sustaining? Are the hotels being able to continue to operate? What is being done to continue to support this industry while many people are really continuing to look for work? And we know that not a lot of the hotels are up to full capacity in terms of staffing. But what is sort of the outlook for the tourism industry heading into next year? And what are you folks doing on the state level to maybe help to provide assistance for this industry?
A couple things, Ryan. I think, yes, there was a slight fallout in the number of travelers coming to the island since we put in place more restrictive requirements so that you actually had to receive your test in hand prior to boarding the flight. But demand for coming to Hawaii continues to be relatively strong. Over in the few days preceding Christmas, we did average about 13 to 15,000 arrivals every day, which is about half of what the normal traffic would have been. So we continue to see over the Christmas weekend, we were in the 12 to 15,000 arrivals every day. So it's lower than what it has been in the past, but it has been steady. And we are seeing, working with the airlines, we are able to get more people who want to travel to Hawaii able to get tested. And I think that helps our economy tremendously.
Let's talk a little bit about the holidays. How did you celebrate your Christmas? And we're curious to know what your plans are for the New Year holiday.
Well, certainly Thanksgiving and Christmas has been unlike any previous holidays. I mean, we had nobody invited to the home. Usually we host on both Thanksgiving and Christmas gatherings for my family and separate gatherings for Don's family. And the kids are usually at home. But this year, all of my kids decided not to come home at all for the Christmas holiday. So we spent a lot of time in Zoom and Meet on Google to celebrate virtually. And we had no hosted gatherings of either of our families. So it was a very, very different Christmas for Don and I. And certainly, this was the first Christmas that we had absolutely no one over to our home. And it does make for, we're very social people, all of us are, and we enjoy family. I think that's what's been the hardest with this pandemic. It's not being able to socialize with our friends and family members that makes this time really, really challenging.
Looking forward, obviously, there have been family gatherings during this time, despite calls from officials like yourself on the state level and national level for these gatherings to remain small, to remain to your household like you've done. Are you at all worried moving forward into New Year's, where we know a lot of Hawaii residents like to gather? There's mochi gathering, of course, that is happening with families coming together, mochi pounding, I should say. What is your outlook looking into the next year? And are you at all worried about any potential spike in these numbers because of these gatherings connected to the holiday season?
Yes, Ryan, I am very much concerned and asking everyone to celebrate differently in this New Year holiday. Again, Don and I would normally host a couple of gatherings with our families that we are not hosting this year, and I certainly would ask everyone to not host traditional celebrations. And really, if you're invited to one, I would certainly encourage you not to go. We are at a critical time, and we've seen an increase in the number of cases over the last few days, last week or so. So we are seeing the case counts increase, and it hasn't been out of control like it is on the mainland, but certainly we all need to do our part, take personal responsibility, and restrict our social gatherings and interactions to stop the spread of COVID-19.
As we come to a close here, I wonder if you have any final thoughts just looking into 2021. I think so many of us are ready to close the door on this last year. But as you said, we still have a ways to go. It's still going to be several months before the general public can get the vaccine. So what's your message to residents as we head into the new year?
I just really want to thank all the people of Hawaii for taking personal responsibility. I do track the COVID counts all across the country, and Hawaii is doing much, much better than every other state across the country. And it's because all of us have a sense of community. We do understand that what we do impacts our neighbors and what impacts our friends. And we are willing to take the personal sacrifice on behalf of our community. So I just want to ask everyone again to refrain from social interactions that spread the virus. It's so important. We are at a good place right now, and if we can just maintain that for the next week, we would be out of the real critical period of the holidays. And with the vaccines coming, and we know that every week we are receiving vaccine doses. We're working through the priorities, and we do expect in another month or two that we will be able to offer it to the general public. And certainly 2021 will be a much better year for all of us as we can make a commitment and work toward bringing visitors back again and getting our economy going.
All right, Governor Ige, thank you so much for taking time on this Monday morning to share some of these updates, and really for taking time throughout the year to join us. We know you're busy, but we certainly appreciate it. And we look forward to more conversations heading into January as well.
Thanks, Ryan, and thanks, Yanji. I really appreciate this opportunity to talk with you and talk to the people. Aloha.
All right, aloha. Governor.
Well, good to hear from him. And, we're still diving into the details of the CARES Act too. And it was interesting to hear him talk about some of the things that are going to be coming, some of the resources that are coming to Hawaii, and some good news there that he says the furloughs will be delayed. It's just a matter of figuring out what the actual delay date is. And he said that he's going through, all the numbers right now, and they are going to announce that in the coming days. So that's good news. A lot of money, he said, for education, and also more rental relief. And just, he said, a loosening of the restrictions on the money, which is giving states some freedom that they need in determining what their actual needs are.
Yeah, and a big difference with this sort of second round of this CARES Act funding is that they are a little bit more specific with some of these programs that have been stood up. So there is specific language within the bill for education. There is specific language for rental relief. Whereas in the other version, it was sort of up to the states to sort of establish some of these programs and set up. And so they're going to be looking at ways to sort of implement some of the funding that is coming in through this new bill and what it will allow the state to continue on and what they will need to set up. The biggest also difference, I think, heading into this will also be the legislature. We know that they are a big part of the state budget, obviously, and planning that forward. And they will be, of course, gaveling into starting session next month. And so there will sort of be a collaboration that we hope to see between this current administration as well as the legislature to see how some of that money gets spent and where directly that money will be allocated for programs and for those who specifically need it.
Yeah, and also he got his opinion on a couple of things. He does not support the idea of having a casino in Kapolei, and spoke out to the reasons for that. He also talked about the vaccine and saying that he would be open to amending the Safe Travels program to allowing people with verified vaccines to come here without any restrictions. So that could be a big change. It could incentivize people. I mean, not that I think most people are pretty incentivized to get the vaccine, but it is yet another reason because it will allow for a lot more mobility for, if you're a returning resident or if you're somebody who just wants to come to Hawaii.
Yeah, and we could also see, as he said, some changes to the Safe Travels program with the second testing. We know that Mayor Kawakami has put in requests for that second testing to lift that 10-day period of quarantine that visitors to the island are required to do. We know that the mayor has requested to allow his island to have that second testing. The governor is saying that he is open to that idea, that he continues to talk with the mayors. And so we'll see what changes happen in this new year, knowing now also that there is more funding that is coming from the national level and how that may impact his decisions to allow the counties more flexibility with the second testing.
Yeah, and also very reassuring, I thought, to hear that having that test in hand and having to have verified that you have a negative vaccine or negative COVID-19 test has led to a 50% reduction in the number of positive cases coming into the island. So many people, would like to have secondary testing, but absent that, the change that he made that was, not necessarily appreciated by many, especially in the business community, because it does restrict the travelers, is actually leading to some really important changes when it comes to the count.
Yeah, he also shared some numbers of 13 cases that have actually popped up on Hawaii Island over the week because of an influx of travelers that are traveling to the Big Island, maybe because of course, the holiday season. Also, a lot of people heading to the volcano as well. So a lot of interest of heading over to that island. So we'll see how things pan out and move forward. And one way that could help with all of this is the availability of rapid testing. And we're going to dive more into that in our next show to round up the year.
Yeah, we're very excited to bring back Dr. Pat Sullivan. He is the CEO of Oceanet, which is a locally based company that is working on Assure 19. That's a rapid test. The last time he was on here, he was saying that he was just weeks away from seeking FDA approval for that test. Produced in mass, he said he could get it anywhere between $5 and $20 for a rapid saliva test, much like a pregnancy test. You spit on the test and you get 2 lines if you're positive and 1 if you're not. And so we're going to be talking to him about where that is in the process, because having that kind of testing availability could be a huge game changer for businesses, for schools, for mass gatherings of all kinds.
Yeah, so we're looking forward to that conversation. We invite you to join us right back here on Wednesday at 10:30. We're going to be taking Friday off once again to celebrate this holiday season, but we look forward to seeing you then on Wednesday at 10:30 here on Spotlight Hawaii. Until then, stay safe, and we'll see you then. Aloha.
Aloha.